Welcome to PathPulse, Pathology Innovators in Action, your go-to podcast for practical and implemented digital pathology insights.
Welcome to PathPulse, the digital diagnostic podcast. This podcast showcases pioneers, innovators, and forward-thinking individuals within the digital pathology arena who are making a difference in day-to-day use. I'm James Thackeray, and in today's episode, we're delving into a personal journey that mirrors the broader evolution of our field. My journey in digital pathology, from training in a traditional workflow to transitioning into a digital environment. And we're really honored to have our guest today. I'm excited to get into it. Dr. Osama Khan, a dual U.S. and Canadian board certified anatomic pathologist and staff pathologist at Natera, where he spearheads digital pathology solutions. So I'm really excited to have you, Dr. Khan. If you don't mind, maybe introduce yourself to our listeners and give us a little bit more background. We're excited to get into this.
Sure. Well, thank you very much, James, for having me as a guest on your podcast, and for the kind introduction. I really appreciate that. So a little bit about me, as you kind of mentioned, I am a board certified anatomic pathologist. I completed my training in anatomical pathology in Canada in the University of Ottawa, and had 5 years there, and then I transitioned to a fellowship, a genitourinary pathology fellowship at Stanford University. And, I think that part of my journey was unique because obviously it was in two different countries, but also it was in two different types of workflows. And I'm sure we'll get into it, but, when I was in Canada, it was more of that kind of traditional workflow, which, the majority of pathology training programs are, having glass slides, microscopes, showing cases to colleagues. And then when I transitioned to fellowship, we were completely digital. We had a bit of a hybrid situation where there's still some glass slides, but it was at a very unique time. I basically had started my fellowship at the tail end of COVID. And that was a very obviously unique challenge from, with patients and the medical kind of community in general, but something really positive got spun out. And that was the adoption of digital pathology, as we had to really adopt different workflows as pathologists and in training programs. So I'm sure we'll go into that a little bit more. And then, through that too, I kind of, saw my unique passion for, digital solutions and working in a digital pathology environment that I, being in kind of the heart of Silicon Valley, you had all these different opportunities, and, with some, really good networking and patience, I was able to transition into an industry position as a staff pathologist at Natera, which is a global leader in cell-free DNA testing, where I work in the oncology and genomic space. So, I'm really looking forward to kind of talking a little bit more about each one of these areas. So, that's kind of my overview, and hopefully it gives you a good idea as to that journey aspect of my background.
Well, thank you for that. This is going to be exciting. This is great because you really do have a unique perspective from the timing of when you started to what you came into your fellowship at Stanford during that COVID. So let's start there because I have a lot I want to get to, but let's start with where you started and being trained in the traditional ways in pathology and then making that transition. Maybe just talk through what that was like. I understand that COVID probably forced us into that. But if you looked at challenges from that transition, kind of talk us through that, and then what you saw maybe right away that you were like, oh, this is so much better, or at least you could see where digital could take you.
Yeah, I mean, it's a great question, and I think when you are starting in a, we're using the word traditional workflow versus a digital workflow only because there is a digital workflow, but before it was just a pathology workflow.
Right.
And so I think, to be honest, I guess I was naive. I didn't know any better. So, and, digital pathology wasn't, it wasn't fully integrated in a lot of, training programs and also like hospital systems. So it was a great time to kind of, really learn kind of the bread and butter of what pathology is. And, going through that traditional workflow, you still did learn kind of what pathology is. But, there were certain challenges that you saw in a traditional workflow. And the only reason I'm talking about it from a challenging perspective is, obviously I did transition into that digital workflow, which you're mentioning. So I think one of the big things is, you do have physical glass slides. And so when you have physical glass slides, you need to have a microscope. So you are kind of, geographically, I guess you are tied to your microscope, and you have to have, your slides, you have to store them, you have to track them kind of manually, and when you're looking at with glass slides, you have, the unfortunate mishaps can happen. You can actually break slides. You can lose slides. And so that's like one of the things that, can be a bit of a challenge. And when you transition into a digital workflow, everything is whole slide imaging. It's very high quality, and it's stored in the cloud. So you can, the memory is kind of your, kind of your limiting factor, but it frees up a lot of space as well. And, in hospitals as well, that's one of the biggest things is, space is really a commodity. And a lot of the time you can only keep, imagine a hospital that's had cases for over 30 years. You're going to have to, as a pathologist, sometimes if there's a recurrence of a tumor, you might need to take a look at a slide and a previous slide, and how do you retrieve them? So often, a lot of the slides, they get put off-site into secured storage locations, and you have to retrieve them, which takes time and can affect kind of turnaround times. And so when you have a digital system, it's right there. You can go into your archive, you can pull up different cases, and logistically it is a lot quicker, and kind of enhances, prevents that, slide transport, kind of aspect of retrieving cases. And then, like we mentioned, like turnaround time too. Traditionally, if you are having to get a second opinion with cases too, you have to, if you're going to be showing it to a colleague in the hospital, that might be easier. But if you have to get a consult from another if we were in Canada, I needed to get, a consult for someone in the US, you would have to ship your slides. So there is that, you have that, part of the workflow that's going to take time, and there could, you could lose samples, and, slides could break. But in a digital system, you could essentially, you've become from local, you've become global now. And all you really need to do is somebody needs to have a digital viewer. It might not have your same platform, but, and this is why you can get second opinions from anywhere in the world. And I think that that's so powerful because, people, we're here in the US, and, we obviously love our colleagues, but, there's a lot of international expertise out there too. And now you're leveraging that aspect because you've gone digital. And I think that's so powerful. And, I've experienced that as well, reviewing cases internationally, but also sending out cases, which is great. And I think one of the things too is we're talking about, at the end of the day, pathology is a medical specialty. So we are in the business, I guess I would say, of patient care. And so having, increasing your diagnostic accuracy and collaboration, I think when you transition from a traditional workflow, both of those aspects just become reinforced and enhanced. And then, lastly, I would say, once you have that digital platform, then you're able to add on. And I'm sure we'll talk about it, but having a really robust digital system will allow you to then start putting on top of it like AI algorithms, and integrating AI. So I think that's one of the things that I saw is when I got to Stanford, it was already there. And, I was forced to adapt, during a challenging time. But I think it's probably one of the highlights of my career so far, because I was able to kind of adapt as a pathologist in a very challenging time. And, being as a GU fellow, one of the things that, was my bread and butter is looking at prostate biopsies. And I know at Lumea, James, they have a very, very robust kind of prostate platform. And I think that really helped me as well, is to look at cases from a different mindset. during my training. And I think, I would say it definitely made me a better pathologist.
That's so great. Thank you. So let's dive in a little deeper on something you said. So we talked a lot about collaboration and diagnostic accuracy, where that can take you, because I think that is so important, especially where so much on the diagnostic space is underserved, right? I think we can all agree we don't have as many pathologists as we once did, and that any efficiency we can bring to that will only enhance diagnostics throughout the world. So I think that collaborative effort that you talked about is so important. But maybe expand, we always think digital pathology when we're thinking technology enhancements as a way to get to artificial intelligence. So for sure, I want to talk about that, but maybe highlight other things that digital pathology actually enables from a technology advancement. You kind of mentioned some things there. I just am trying to tease out a little bit more, because I think we instantly go to AI, and I do think that's a huge driver. But even like collaborating with radiology, for example, or I just want to get your feedback on how do we tie some of these different virtual or digital technologies together in your mind, or like how do you see that playing out?
Yeah, it's great. I think what you've started to actually touch upon is the inherent collaborative and multidisciplinary nature of the specialty. And so as a pathologist, I'm not looking at these cases like siloed, right? We are integrating multiple types of data points, and that in itself can be very powerful when you're digitizing workflows. Is how do we integrate all that information? And I think once you start having a digital platform, then what it does is it allows you to digitize the other aspects of your workflow. So one would be EHR, retrieval of information, having a platform that can link directly to the EHR. And so you don't have to fish for that information and open up another tab. That's definitely one thing. The other thing too is, you're absolutely right. You talked about radiology. Radiology is a great specialty that definitely has image-based as we are, but they're fully digitized. They didn't have the opportunity to have a microscope. So, but we are definitely looking at the imaging. What did the image show? Did they get the lesion in the right area? You're making that clinical, like a radiologic correlation often. And so if you are also having another digital platform, then, you could easily integrate that as well. And so if you kind of think about it, this is how I like to think about it too, is I think, I love sports. And so one of the things I like to do is make an analogy to like a quarterback. And I think a pathologist, I would say, is definitely a quarterback. We are there to kind of call the plays, I would say. And why I say that is, you have a team, but you are the one that's kind of quarterbacking the actual decisions. And so what you're going to do is you're going to draw on, call the play and draw on the different aspects of your team and integrate them in order to kind of have a successful outcome. And I think that's kind of when we talk about the mindset shift, that's what ends up happening when you start adopting these digital technologies. You don't work in a silo anymore. You start to actually integrate all of these different components that you're doing as it is, but it's increasing your efficiency. And you don't have to have 5, 6, 7 tabs open at one time. You can easily integrate it. And from there, it's really important for patient care, because then it ensures that you also don't miss anything, and that you're doing things in a very regimented manner. And, and I think that's what the pathology specialty is. So as long as you can, when you're adopting a digital workflow, you should mimic your regular workflow and try to adopt that. So that's kind of how I see the benefits of digitizing a workflow. It kind of helps bring in all that collaboration.
Well, and you said it so well. It's bringing pathology as a specialty kind of out of the silo nature that it probably, or at least many have thought it historically has been. And I've worked with so many phenomenal pathologists over the years, and it's almost like bringing bringing the specialty out of the basement of the hospital to really be the centerpiece of diagnostics in a way that it probably is there, but now all this technology only enhances the ability for you to manage that entire diagnostic workflow. So it gets me excited, sorry, as you can tell, because I think it's where the pathologist should be, right? It's not only that, and I guess maybe this is where my question would go next, is the role that the pathologist now plays into not just the original diagnosis, but into even therapeutics and ancillary downstream testing and kind of maybe talk to us a little bit about that. Obviously, you work for an organization that does a lot of really cool stuff on that side of it. So maybe we transition to the role of a pathologist in association with that part of the diagnostic journey, if you will.
Yeah. So, I mean, that kind of, really goes into like a question I get on a daily basis. I'm sure you're kind of have heard that too, is, will AI replace a pathologist, right? And so with that, most of the time, it's always a resounding no, right? Depending on who you are. Just kidding. Yeah. But, yeah. I think that's really important because that goes to show you how complex cancer oncology is. We have very complex staging when it comes to cancer, and we've now only gotten more complex, as you had mentioned. And I think one of the central roles of a pathologist is actually being involved in those ancillary testing. So molecular testing, biomarker testing, and now where I work is MRD testing, molecular residual disease testing. And I think that, I think when it comes to patient care, the pathologist now, it's not just about, what is the cancer, right? And just your diagnostic impression. It's like, okay, let's get more specific and personalized to the patient. What does this cancer show? What is its immunohistochemistry profile? What is its molecular profile? So we can, and that is commonly tied to some sort of patient personalized therapeutic regimen. And so that's really important, is now we can actually get a specific insight as to what type of cancer it is. And I think that, testing those biomarkers, it's the pathologist, right? We are the ones, it's easy to order them, but who's interpreting them? So it's definitely a pathologist. And that's one of the things that we are responsible for at tumor boards, is giving the result of those biomarker testing results. And I think that, when it comes to AI, this is definitely something that, like this biomarker testing, there's a lot now of AI algorithms that are being approved, such as like HER2 for breast, ER/PR. There's many more that are getting kind of FDA approval, almost it seems like on a daily basis, in specific cancer types. And so I think that, one of the things that it does is it also increases the pathology specialty and the advocacy for patients, because they now know that a pathologist is central in a lot of these areas. And so kind of transitioning to kind of what I do now is I would say that we're, I guess, at the, and I always put this in quotes, but we're at the end of the patient's kind of cancer journey, in the sense that we know the patient has cancer. We're now going to test them for molecular residual disease and see if there's any cancer left in the patient. And so how that works is, in our body, when cells die, they give off something called cell-free DNA. And that's something that we can detect. It has a very, very short half-life. And so if we can detect it, we can really say that it is there because of the short half-life. Tumors do the same thing. When when a cancer is inside a patient's body, they actually put something into the blood called ctDNA, circulating tumor DNA. And that is something that you can actually test. And so that is something that, we can test it in the tissue and in the blood. We can then track that patient over time and see if that patient has had a recurrence, where you can then, if the circulating tumor DNA has increased, we can then, the oncologists can then potentially initiate treatment at an earlier time. Or I think on the flip side is if the patient doesn't actually demonstrate any circulating tumor DNA, you may be able to de-escalate therapy, toxic chemotherapy or radiation. So I think that's another kind of area that's really, really important is MRD. And we, I'm sure we'll get into it too. One of the reasons why I was kind of recruited to this role was they wanted to digitize their entire molecular workflow. And that's kind of where I stepped in and helped to validate a digital pathology system. And, we have 2 sites, one in California, one in Austin, and where they're both completely digitized. It's actually a very, very unique workflow in the molecular space. Not a lot of institutions are doing that. So I've been really fortunate to kind of lend my expertise into that MRD molecular workflow.
That's so helpful. And I really appreciate that, that latter half of the patient journey perspective, because that still is part of this whole journey, right? It just may be later stage. That's really an interesting point. I think Natera is a little bit ahead of the curve on the molecular side of it, and I think others are quickly joining the game of digitizing that workflow, or at least digitizing the molecular as much as they can. But give us the why behind that. Would you tell us what that potentially might be able to do if you have a digital platform on that side of things?
Yeah, that's a great question. And I think at the end of the day, what it comes down to is enhancing workflows. And, at each stage of generally how a molecular workflow kind of works is, you'll receive the actual patient's block. You will then often we request the best representation of the patient's tumor. Institutions send us the block. We will actually cut it in-house. We'll stain it, and then it will be ready for pathologist review, and it will be digitized and scanned. And then after, we have something called macrodissection, and macrodissection is actually we annotate the tumor from the pathology side, and the macrodissectors, what they do, they're trained to actually scrape the annotated areas in the tumor and then put them in tubes, and it gets sent downstream for extraction and downstream testing. And so one of the things that a digital workflow for that does is we're able to review cases a lot quicker. We're able to, I always tell people too, if you like art, then pathology may be the specialty for you. And so, I kind of, and I do this, and I kind of jokingly say I'm drawing all day long, right? But I think what we're doing is actually we are looking at these tumors at a very high resolution, and we are able to annotate the tumor area at a more, at a high level. And I say that because, how I had mentioned that a lot of these patients, the MRD testing is at the end of a patient's journey. A lot of these patients have already had surgery, they've had molecular testing, and they've also probably had neoadjuvant treatment. So the tumor that we're looking at is not how it looked before. And that can give a lot of challenges. There's a lot of areas of fibrosis, necrosis, and, good for the patient, but sometimes there is no tumor left. But for our perspective, it's not good for molecular workflow because we are looking for a certain percentage of tumor nuclei. And having a digital platform can really enhance that and increase your accuracy because we're able to see it at a higher, at a higher quality. And then also the other thing too is we're also able to then collaborate as well. We have consultants on site. We also have some remote pathologists. They can actually log into those systems, can also help us review cases, but we can also collaborate on challenging cases. So very much the same as in kind of academic diagnostic world, we're still using some of the bread and butter pathology kind of training techniques that we have learned to still do it in kind of an industry, kind of in an industry setting. And then lastly, we always talk about it. I'm going to use the word AI. So because you have a robust digital system, you're then able to add on things like immunohistochemistry, biomarker testing. And that's an added application that you can add on to your digital platform that can just help increase the patient's kind of MRD testing journey.
That's so great. This has been such a unique perspective because your individual journey and then ending with this technology organization where you are currently. If we were to try, and I can tell already that we'd love to have you back because I have like 10 other questions going on in my head right now. But just as kind of final thoughts or advice, what would you share to other fellow pathologists that we haven't covered or that you'd like to just highlight? Like, this is actually a positive, or this is what it could become when it comes to digital pathology.
Yeah. One thing I'll say, James, is I always try to be very positive. And, I always tell people who do contact me like, hey, we're looking to kind of start our digital pathology journey. We have a lot of, and I say, listen, you can do it. It is definitely doable. And I reference COVID, right? We came out of a very challenging time. It's crazy to think it's almost like 5 years, but during that time, we had to adapt. And we had to be, I say we were forced to do it, at least at Stanford, but a lot of facilities had to change their workflows. So I know that pathologists and their greater pathology kind of histology team, they can definitely be successful in adopting a digital pathology because we've shown that we can do it. And, we'll talk about those specific barriers and we can get into like regulations and, buy-in from different people. But at the end of the day, I know that one of the things that we can do as a pathology community is we can adapt. And that's one of the kind of positive messages I'll say is, once you kind of adapt and integrate into a digital pathology workflow, you'll never go back. And so it's just taking that first step. People are here, everybody on your podcast. These are all like, key opinion leaders. They're all people who are champions of digital pathology. They're out there, don't be afraid to ask. We talk about collaboration. Ask a question, collaborate with people. We're also, we may have expertise, but we're also learning. Every day new things are happening. So, I would just say like, don't be afraid to take a chance. I mean, everybody will definitely at some point experience digital pathology if they haven't already. And, that's my positive message, that everyone can do it.
Well, you certainly feel your optimism, and we appreciate it. We appreciate your insights on this journey thus far, which is just getting started for you. I feel like there's many amazing years in your career, especially with the direction that you're going. So we really hope to have you back on another podcast. But thank you again, Dr. Khan, for your time. It's been a pleasure.
Thank you so much, James. Yes. And, I look forward to chatting with you soon.
Great. Thank you.
Thanks for listening to PathPulse, Pathology Innovators in Action. Tune in next time for more inspiring conversations with digital pathology experts.